an original MCM production.
Now, on to our program. Charlie Evans, an Associate Director at Marietta Investment Partners, will introduce our speaker. Charlie?
Thank you, President Nancy, and good day, everyone. It's a pleasure to kick off Young Professional Month here at the Rotary Club in Milwaukee, and it's an honor to introduce our guest speaker today, Vanessa Tobin. Before I delve into Vanessa's biography, however, which is as extensive as it is impressive, I'd like to first offer some very basic context as to why she's here and why the subject she'll be speaking about is so important. Today, 2.6 billion people lack access to improved toilets, and 1.1 billion people lack access to clean sources of water. Drinking water, that is. The impact such figures have on our world's health, education, and economy are profound. Indeed, the 2016 Global Risks Report produced for the World Economic Forum identified water crises as the top major risk facing humanity today. In 2007, recognizing the growing scale and urgency of this issue, Rotary International formed the Water and Sanitation Rotarian Action Group, also known as WASRAG. In modeling this group, one of the people Rotary International reached out to for advice was Vanessa Tobin. Vanessa currently works with Catholic Relief Services based in Baltimore, Maryland, as their senior technical advisor for water supply, sanitation, and water resources development. Prior to that, she spent 24 years at UNICEF, leading efforts to address water-related challenges around the world, including places like the Philippines, South Sudan, Lesotho, Pakistan, Egypt, and Nepal. I'm also told she just arrived home from Nairobi, Kenya on Sunday. Vanessa holds a Bachelor of Science degree in Civil Engineering from Birmingham University in the United Kingdom, 2 master's degrees, one from the Public Health School at the London School of Hygiene and Tropical Medicine, and a second from the Public Administration, a second degree in Public Administration from the John F. Kennedy School of Government at Harvard University. She has spoken numerous times at Rotary and international conventions, including the Water Summit in Seoul, Korea, which I believe some of our members were fortunate enough to attend. She is an inspiration to our own club's World Community Service Committee, which is focused on water, sanitation, and hygiene projects, primarily in Guatemala. I only met Vanessa an hour ago, but let me tell you, her expertise, experience, and passion surrounding this issue are obvious, and we are very, very lucky to have her with us today. So without further ado, please join me in welcoming Vanessa Tobin.
I think you can see that obviously from the number of years that Charles has talked about, I'm very old. So without further ado, I'm going to launch into my presentation, which is really looking at water and sanitation from the word that's become now so crucial to the sector, and that's sustainable. What are the challenges and what strategies can we use together in going forward? First, there's a lot of good news, and we tend to focus on all the negativity in terms of the services that don't work and what hasn't been achieved. But certainly in the more than 30 years I've worked in development, there's some incredibly good news, and there's good news in the sector as well. 2.3 billion people around the world gained access to drinking water, and 2 billion gained access to sanitation. This is from 1990. Water supply target was achieved in 2010 for the Millennium Development Goals, and the goalpost was 2015. 56 countries have already met the Millennium Development Goal target of halving the number that don't have access to water supply and sanitation services. And children who die from diarrhea, strongly associated with poor water and sanitation, fell from 1.5 million to 600,000. These are all great achievements. If you look at the countries in which less than 50% of the population use improved drinking water, now nearly all of those countries are focused in sub-Saharan Africa. And that is as a result of a lot of the efforts that we now know that certainly significant efforts need to be still given in terms of Africa. If we look at sanitation, there are only there's 95% that have met the MDG target at the present time. The ones in green are those that have achieved the target. Light green is good progress. Moderate progress is in yellow. But in Asia and Africa, progress was not significant. It was limited or no progress at all. Some progress, moderate progress in India, some progress, but still certainly didn't hit the Millennium Development Goal, and a lot of work still needing to be done. So there are still challenges post-2015. Did we really achieve the water supply Millennium Development Goal? Why has sanitation coverage not significantly improved? What needs to change if we are to reach the poorest with sustainable services? 663 million. As a result now, the number of people that don't have access, and the basic indicator that's used in most countries is 20 litres of water at a distance of 1 kilometre from the house. So 663 million people remain without that. In Ethiopia and a few countries, they set it at 1.5 kilometres, but invariably, mostly it's been set at 1 kilometre. At least 1.8 billion people globally use a source of drinking water that's contaminated. So it means that we did manage to succeed on providing clean water, but we haven't reached the challenge of safe water. And there's still nearly 2 billion people that don't have access to safe water. When we say safe, we mean it has to be clear of any chemical or microbiological contamination over and above standards that are set on the country level, and those standards are about 90% dependent and set by World Health Organization standards. There might be some variation, but they usually stick to those, about 90%. 36% of the global population are still without improved sanitation. So even though many people hit the targets in reducing the Millennium Development Goal of reaching 1/2 of the people on sanitation, many countries that made enormous progress, it hasn't negated the fact that 36% of the global population are still without improved sanitation. Improved sanitation is just a basic toilet. 1 billion people still practice open defecation. But these are the figures that with all the progress that's made, that we have to focus on. That 35 to 40% of systems in sub-Saharan Africa are not working. The definition of coverage is usually, as I said, 20 litres at a distance of 1 kilometre. Well, that's still a long distance for a woman to have to travel to collect water. And we're only estimating that over half the world's population has access to a tap, either in the house or in the compound. Only 56% have a tap in their house or less than 1/2 kilometre away. And as I stated, we focused on clean rather than making sure it was safe. Water scarcity. is a big risk factor too. More than 40% of the global population is at risk, and we're projecting it to rise. Over 1.7 billion people are currently living in river basins where water use exceeds recharge. So the health and lives of more than half the world's children are threatened by contact with human excreta. Caring for sick children adds up to the already heavy workload of women and girls. And about 44 million pregnant women have sanitation-related worm infestation, usually hookworm, since they're getting infected when they're in the fields, invariably. We know the health considerations, but we design our programs with these in mind. Country data on the level of implementation of measures in WASH plans for sustaining and improving WASH services. And basically, we still have, most countries have specific measures in their national plans to improve and sustain service coverage. However, the level of implementation of these plans is generally low. That there are national plans for water supply. There's national plans now in most countries that are either in place or about to be put in place because of the emphasis of the MDGs on sanitation. But the actual implementation of those plans, high level of implementation, is the darkest color. The next is some level of implementation. Then the third area there, which is the light brown, is a low level of implementation. And the dark brown at the end is no implementation. It's not on the program. And as you can see, that policies may be in place, the actual implementation of them is a major question. And after the Millennium Development Goal and the time that we spent, which was baseline of 1990, even though the goals were set in 2000, over those 25 years was the focus on the poorest. In the 48 countries designated as LDCs by the UN, most have not benefited sufficiently from improved water and sanitation services. While 54% of the global population use piped water, only 11% living in least developed countries have household taps, and only 3% rural. And the impact on health. We know the benefits. Looking at 172 demographic and health survey data sets from 70 countries, we identified and proved the robust association between access to water and sanitation, child morbidity and mortality. Water and sanitation lowers children suffering from diarrhea by up to 17% and reduces mortality risk up to 20%. The impact of water technologies is less than the impact of sanitation and, on health. It appears from the data that's been collected from looking at water supply and sanitation to date. One of the growing areas of operational research in the sector at the moment is looking at what was classified as a disease called tropical sprue, and now is classified as tropical enteropathy or environmental enteropathy. It was the belief that most children that were suffering from diarrhea that then led to either some form of malnutrition or severe or acute malnutrition that then would lead to death was as a result of diarrhea. But the relationship now is showing it's the relationship between the number of episodes of illness, the infection, and the enteric infection load that a child has. And if a child is suffering from 5 to 7 episodes of diarrhea a year, and from worm infestation, or from other enteric infections, this is what's invariably affecting absorption of nutrients and will lead to mild to moderate malnutrition, and is a major contributory factor to stunting. And this has been documented in Lancet, 2009, 2013, 2014. A lot of work's going on in it, including CRS looking at this now in Tanzania and Kenya, which was, my trip to Kenya, was a project researching this, looking at the impact on stunting of water and sanitation measures integrated into ongoing health programs that target under 2s. Environmental enteropathy is very common. Nutrient absorption is reduced, intestinal wall leaks, allowing bacteria into the bloodstream. The issue of absorption of micronutrients and the role played by safe sanitation and hygiene is often overlooked by nutrition professionals as well as health professionals. And how we mainstream effective water sanitation hygiene measures into ongoing health and nutrition programs targeted at under twos to impact on stunting is now the work that many organizations are looking at to do more effectively. This is what leads to trachoma. I talked earlier today about the next drive on eradication is most likely going to be trachoma. Guinea worm is only in one country now, it's in South Sudan, and it's the Carter Center that led the drive on guinea worm eradication. A horrible, horrible disease. It doesn't kill, but it's a disability that it causes in terms of its development within limbs and causing extreme pain. And it's now virtually nearly eradicated. It probably will be with polio. These will be the two diseases that will be eradicated next. And the Carter Center is then focusing on trachoma as its next disease for eradication. Trachoma, again, like guinea worm, is a neglected tropical disease. And it's invariably caused by flies which are transmitting, and of course by dirty hands that can transmit infection to the eye, which eventually, gradually leads to blindness. And, you know, if we were only providing water for drinking and cooking, and we're not providing water that people can wash their hands and wash their faces, then we're not dealing and addressing major health concerns. One of the countries that has the worst form of and cases of trachoma is Ethiopia. It's in the Amhara region, which is ground zero for trachoma. 20% of the population carry 45% of the country's trachoma burden. There are 17 million people living in those areas, and the highest rate of active trachoma is in children 1 to 9, 62%. Prevalence mainly due to poverty, poor access to water, poor sanitation, families living in small huts, crowding. Mothers or children have to walk hours to collect water in these areas still. Certainly, if we're going to address these diseases, we don't address them without bringing water even nearer to the house. Sustainable Development Goal 6, as you're aware, there is now a new development goal which was announced and developed with the United Nations and announced by the Secretary General. And its targets do include, again, safe water, but it now talks about safe rather than clean. Talks about sanitation and hygiene for all. It's also introduced another variable that we haven't measured or monitored effectively, a couple, but this one is really important, is water quality. We talk about water quality because, of course, the microbiological contamination is a big risk in terms of any contamination from human excreta into water, which is the worst form of contamination that can happen. But there are growing problems on chemical contamination on water. In South Asia, Bangladesh, as you may be aware, 30% of the wells were contaminated with arsenic, which was above the WHO recommended level of 10 parts per billion. There has been measures in place that's been introduced in Bangladesh since 1998 to address that problem. The problem has emerged in many other countries, Nepal, Cambodia, India. There are about 15 countries that are being monitored right now on arsenic. We have now found arsenic in Rift Valley countries. We found it in Uganda and in Ethiopia, and now to investigate Kenya and Tanzania as well. Thailand has been dealing with problems of arsenic for many years and has a very comprehensive water quality program in place to address it. But there are other chemicals we need to be monitoring as well, and monitoring those very effective. Fluorides is one of them. Well, we've had problems of fluorides in Ethiopia and in China and in India and Bangladesh and many other countries. Also, the need to monitor nitrates. To have effective monitoring of water quality in place, and then to be able to stop people using sources that are contaminated above levels that are not recommended by the World Health Organization. Water use efficiency is a big area. We talk about needs for agriculture and we talk about needs for domestic. In rural areas, we have to talk about both. And invariably, the use on agriculture the misuse of water is a major threat for domestic water supply. And how that water is used efficiently. Legislation alone makes no difference, and India showed that it really is the checks and balances and having communities properly educated, understanding this, and not dealing in a siloed effect of addressing water. The others are integrated water resource management at all levels, protecting and restoring water-related ecosystems, and much more collaboration and capacity building. So what needs to change? There needs to be, as there has been, as there was in all of your efforts on polio and why it was so successful, that these do need to be national-led efforts. Governments need to be managing these services, even if they don't have the capacity to implement. They should be facilitating and regulating. In least developed countries, governments can't support full implementation by any means. The role of NGOs, communities, and local private sector, local enterprises, small enterprises, are making the difference in many countries at the moment. In Madagascar, we developed a project that worked. It worked with central and local government, but the capacity of government was limited. So it also worked with middle-sized, small to middle-sized private companies that then trained mechanics, then trained operators, private service operators, to both build the systems, collect the tariffs, and repair the systems, and to set that in motion. And now, of course, with the US government working with the government again, we're bringing central government into seeing the model and how it's developed and what's happened with this. And there's an example where, we have to understand what the reality is, but we do have to involve everybody in the solution. Why is sanitation still not being taken seriously by the health sector? By health and nutrition. You'll still have articles in The Lancet written by the world's most renowned nutritionists, and they'll hardly give a mention to WASH within those articles, or acknowledge some of the most recent work that's been done on environmental enteropathy. This is still a question mark, a big question mark. And why do we focus on educating adults on transmission of disease in communities when most of our mothers, trained us in hygiene without understanding the intricate details of disease transmission or anything else, because they knew it was good for our health. They knew it was important because this was part of systems that was passed down over generations. And that's really where the focus has to be, is not on providing every last detail on transmission of disease. And why the E matters. We can't now talk about water and sanitation without talking about environmental factors. Water scarcity. Groundwater levels are decreasing. You've got a decrease in some groundwater levels in Asia, in Dhaka, in Bangladesh. It's gone down 40 meters over the last 5 to 7 years. Well, that's quite significant for any rehabilitation work that's required for water services, groundwater services. Quality is being affected, and climate change could profoundly affect future patterns of both water availability and use. And financing. With 70% of countries reporting that tariffs do not cover the costs of operation and maintenance, the quality of services and coverage levels are at further risk of decline. People don't pay. Now, one could say, poor people can't pay. Well, that's true, but what about people that are living in cities? They didn't pay for the installation of those services. They're already there. And do they pay any sufficient tariff for those services in many countries? No, they don't. And therefore, what is the barrier? Where are the barriers in terms of raising those tariffs for people that can pay, that can subsidize those that need more support? Operation and maintenance must be costed. When a project is built, it can't be on capital cost. We have to cost out what will it take for that project to run for 10 years? Minimum 10 years. What would it take for that to happen? And that has to be costed into it. So what are our good practices? Well, there's no question that Rotary is one of the organizations that over decades is renowned for good practice in any sector it's ever worked in. Good practices are, of course, efficiency in terms of introducing technologies and then sticking with those technologies to test them over time. There's a lot of complaints in the sector there's not enough innovation. Well, an innovation has to be tested and tried for 10 years before you can call it an innovation that can be promoted. It can't just be an innovation you introduce because it may not work. And if you don't put the investment into time and energy to see that it actually works, it's not an innovation. It's a problem for a country because they have to replace those technologies. Mainstreaming the use of multiple water use approaches has been used in many countries, which then integrates their domestic livestock and agricultural needs. And that's been done in places like Ethiopia, and it's been done in arid areas of Kenya, where it can be done to be promoted. And then many countries are now looking at what they can do in water use efficiency. India is probably one of the best in this regard now, and looking at pricing of its water. So 5 factors for Rotary to consider where you can make a difference is in your support for water supply, sanitation, and particularly as you're moving forward, is on the governance. Looking at the politics, water is one of the most political areas that anybody can ever work in, because it's political at the local level and it's definitely political at the central level. So depoliticizing it becomes important. The financing mechanism, somebody has to pay. Who pays and how do they pay? Governments won't pay as much as they should. Nobody's paying for operation and maintenance. The donors won't pay, the governments won't pay, communities can't pay, so who pays? The environmental factors and equity. How do we still get to those who need it the most? And that focus on children, as you go forward, you're looking at water and sanitation at schools. And schools can act as a model, and teachers obviously can function as role models in communities. And that's been very successful through the work on WASH in schools. And WASH in schools has been pivotal on its focus on girls. Girls are more vulnerable because of the distances they have to walk, insecure areas that they have to travel to be able to get some privacy. There is invariably a problem in protection when they are traveling. Infrastructure designs do not necessarily consider women. Collection occurs of water at high-risk times. And there are few societal controls during conflicts when those arise. And sometimes, in fact, many times, I'm afraid, male community leaders are not considering sufficiently the problems that women face in water. And the WASH in Schools initiative that now Rotary is gearing up and really moving on, the coalition around WASH in Schools developed in 2006 to 7, was started by UNICEF, and the work around it is that only 50% of schools have adequate water and sanitation facilities. And why do we want to focus on them? Well, evidence shows healthy children perform far better at schools. Data from low-income countries show that in 2011, that only 51% of schools had adequate resources and only 45% had adequate sanitation. And that lack of privacy at schools may be driving girls out of schools if they don't have the privacy that they need. So this is a campaign for clean drinking water, basic sanitation facilities, and hygiene. CRS, we're involved in supporting 10 to 20 countries around schools and promoting WASH services with national organisations, local government communities, and school councils. There's 5 key components. There's the water and sanitation services, hand washing with soap, hand washing facilities, hygiene education, and the policy environment that pushes it forward as much as possible. And that, the examples of what it sets and how it's managed, Pakistan, we had school enrollment of all children increasing there over 7 years as a result of the water supply program and sanitation that focused on schools. Worked through the Department of Education, which was very important. Political commitment, getting that from the highest level is very important. Here's an example of the Minister of Education in the Philippines. And having them very involved in it. Financing, in terms of where is the money coming from that's going to look after those facilities and maintain them and make sure facilities are constructed to the right design and purpose. In Honduras, there were parent-teacher associations that were heavily engaged and involved. And then engaging women. If we don't engage women from decision-making all the way down, then it's very difficult for them to really benefit and to be taken seriously in the whole process. In Ethiopia, we had an Empowering Adolescents Girls project, which was supported by the private sector, and that looked at addressing out-of-school adolescent girls and bringing them back in, and looking at the benefits and working with government and local partners to do that. The sector, unlike health, tends to not to undertake the same level of research that's needed for the sector. And there is as much research needed for water and sanitation and hygiene as there is for the health sector. It's different, but that research is necessary. We need to look at it across the board. We need to look at it at our work, obviously, on water and sanitation in schools. We have to look at the problems around effective governance of water, and we need to look at the health implications, but in a way that's more practical, rather than looking at health impact without looking at whether even any necessary behaviours have been influenced. We're very familiar with the pictures, the images of water and children. And these images have been highly effective in fundraising for water and sanitation. These images of children around water and sanitation. I think it's our moral obligation now, with the efforts and the energy that we've used on these images, to make sure that every single penny on water and sanitation is spent wisely and is not spent in what can be very short-term projects of very short-term gain. Thank you. Let me open for questions. I think there's a gentleman at the back there. The gentleman is asking about groundwater levels, the deterioration of groundwater levels over time. Correct me, and how we address this and what are we doing to examine this. In most countries, this is now coming up as an issue. It's not so much of an issue in sub-Saharan Africa because only 10% are using groundwater at the moment to the same level in terms of use for agriculture. Whereas in Asia, a very high percent of the populations are using groundwater for agriculture. The worst culprit is agriculture. Second comes industry. We tend to think it's industry that's the largest. It isn't. It's agriculture. To not consider this in terms of development plans by countries and examining their agriculture sector and looking at their water use and more efficient water use means that looking from a water supply side without considering that causes significant problems. A lot of the drop in groundwater in India has been as the result of private wells that have been installed with no regulation, 24/7 running water. Now, a simple water supply domestic system doesn't use a lot of water. It's not a big impact. An irrigation pump and millions of irrigation pumps going in do. Now, the other aspect is you can't divorce that from the environmental side as well. I mean, we can say that, okay, setting aside climate change, deforestation in many of the countries where I've ever worked is a major problem. Nepal. The deforestation in Nepal was painful to see it. And as a result, there was a drying of springs, which drove, therefore, a movement of the population down to the Terai region because those springs were drying up, primarily due to deforestation. So to address any of these problems in an isolated way, of not looking at it from a more integrated perspective, ag needs, domestic needs, looking at some of these environmental factors that need to be addressed, means you're not going to address the problem adequately. Nepal hasn't. All of those springs are gone. Yes, now they're trying to do something on reforestation. they've got a long way to go to be able to do something. So having a much more integrated way to deal with this, and not just deal with domestic water needs, agricultural water needs, industrial water needs, environmental factors. Now we're having a major drive, and I will put this down, I'm 24 years with the UN, that also the UN must be more cognizant of pushing for integrated results, that it's across sectors, not one sector. A sector has, we've seen here, we have a sustainable development goal for water, and then there's a sustainable development goal for environment. And when do we bring these together and examine these and look at them and the solutions, and look to the countries for where they need to be looking at and not just legislation, but enforcing of legislation, and then helping communities. If communities know more about how to address their problems, they'll take a more integrated perspective on it. And that's been proven in India, that when they're given the tools and know more about this, they start controlling water that's used for irrigation. Yes, the gentleman here. Right. Well, it's interesting you ask, because there's a major desalination project for Kenya right now that's under design that we may all... There is an alliance of NGOs, US-based NGOs, which was started in 2005, called the Millennium Water Alliance. It was pivotal in influencing the Water for the Poor Act of 2005 and the Water for the World Act of 2014 that the President passed into action. The Millennium Water Alliance right now works in about 4 countries, two in Africa, Ethiopia and Kenya, and is looking at desalination and how we could be supporting desalination project that would then provide a large amount of water for all of the area near the coast. And of course, desalination is much cheaper and more effective than you could even considered it 20 years ago. You couldn't even, well, you could look at it. Saudi Arabia could look at it, but many countries couldn't think about it or even consider it. And I think that now it has to be considered and it has to be examined. And we may be engaged. We may not be engaged so much from the technical side, but actually looking at the whole revenue collection and how that's managed and where it goes with the Kenyan government. So yes, has to be examined, has to be looked at, and has to be taken seriously. So I hope everybody got that question. I must repeat the question. Yes. We're talking about adaptation of the human digestive system, which, sorry, I'm not going to be able to answer whether that would be possible or not. But I will say that there are simple means of keeping water safe, and the handling of water within houses, simple chlorination, disinfection, and if necessary, filtering of water if there's chemical contamination, can be done, has been done in many countries I've worked in, and it's not too expensive to do it. We do need to monitor. This is big, and I think this is a word that's been lacking in the sector, that there's been monitoring of coverage, even that's not been good enough. That, we actually, I think that monitoring in other sectors has been far more effective. Every year you've got surveys out there looking at immunisation rates, looking at your polio, looking at your cases, your mop-ups, and how many people you're reaching. We're not looking effectively enough at water quality. And as I said, this is going to be the big issue for the next 15 years. This is not just, issues that we see them everywhere. Your country, they're everywhere. They're in the States. My country too. And I'm talking about the States, as well as the UK. But these are serious issues, and we have to be able to monitor them. If we can monitor them, we can take action. If we don't monitor them, we don't know what the problem is, then all of a sudden it erupts and we don't address it. If you're on top of it before the problem comes, then you can start looking at what you need on remediation, what we're going to need in terms of addressing this. If you've got a problem, I think that this is an issue too for everyone. If people know a problem's coming, they're much more able to work together collectively to address it. If they don't know and they're told afterwards that there's a problem, that's when there's a lot of indignation and anger and concern. And so really to be proactive on the water quality issue is going to be the challenge for the sector for the next 15 years. One of the challenges, one of the biggest. Any more questions? Yes, gentlemen, here's two. Right, the question was, why is there such a problem with operation and maintenance of services? Why is it? Why is it the problem that we've been talking about since I entered the sector? That's 30 years ago. I think because nobody's taken responsibility for it. And I think that, donors said it was the government's responsibility. Government said they didn't have the money. Donors didn't give government the money for it. And communities then were empowered to do it, and communities couldn't do it. Because you can train a technician in a community to look after a pump, but what do they do when they can't access the down-the-hole components of the pump because they don't have the equipment to be able to do that? They can't pull up the pipes for the pump. They don't have access to the resources they need for the job that they were empowered to do. Or not empowered to do, trained to do, certainly not empowered. So this disconnect has meant that people have said things like, well, hand pumps don't work in Africa. We need to move to small pipe to water supply services. That will work better. But to me, it's not the technology that's the issue, it's the whole supply chain. And ensuring that, you have a supply chain that provides technical services and provides the equipment that you need to be able to function. And who manages that? And governments alone can't manage that. You've got to have a role for private sector in it. So and who pays for it? Obviously, communities can pay to repair a pump. Can they pay for a new pump to go in there? Well, they can if it's properly organised and it's properly worked out. That is part of the missing equation on it all. And donors have increased, there's no question, including this country. The US is now the 8th largest donor on water and sanitation, WASH. It gives $425 million a year for WASH projects. It's one of the biggest. Since Water for the Poor Act, it's gone up significantly. So the money's going in. It's where the money's going in to. Nobody questions that maintenance budget so much on other programs. You have services, supplies going in for health projects all the time that have to keep those health projects running. So we have to look at how we're categorizing what's needed, and we've got to be able to organize contribution. But when we're asking people to pay for services, and a tariff system is better than asking them to pay all up front for a service that might break down in a few years. If you've got an effective tariff service, you have to have an effective response for a tariff service. It has to function. So if that's in place, then fine, you can collect tariffs. If you collect tariffs and you can't ensure that after 2-3 years that system's not breaking, that it's going to be repaired adequately, you can't hope that that tariff system's going to work. So it is about governance. It's about really having those systems in place adequately and properly. And some countries can do that well, and then Afghanistan cannot. And there's other means and ways that work in Afghanistan that keep things working. Yes, and there's a gentleman at the back here, yes. The question is, what impact will climate change have on water security? I don't want to be alarmed, to get too alarmed on everyone here. I have very strong opinions that climate change will have an impact, but I don't look at climate change by itself. I look at it from an environmental perspective, and that countries need to be considering environmental concerns. And the fact is that if they have less rainfall, if they have hotter climates, and this is invariably what is happening, this obviously is affecting groundwater, affecting water resources, not just groundwater. The impact, though, is if they don't have proactive environmental programs that address some of the issues around more effective water management, reforestation, watershed management, all of these areas, if they're not being more proactive on these areas, forget climate change, you can call it whatever it is, but if they're not considering all these areas, when most of the countries I've ever been in have serious deforestation problems and serious mismanagement of water resources, then if people don't want to address the fact that climate change is exacerbating all of this, that's fine. Just get environmental agendas up and start addressing some of these major concerns. Yes? It's interesting because that is partly what has been under consideration in various countries in the Middle East. And to a certain degree there is some level, but it's not excessive. But I don't think there's any question that is going to happen. There are major also groundwater reserves in Africa that are significant, that are being found even as we speak, and certainly countries like DR Congo have abundant water resources. There's other countries that have misused those water resources that they have, such as Iraq, with the River Euphrates, Tigris, with the level of contamination and whatsoever else that's happened in some of those countries. But there's no question that that will be on the table. It's already under discussion. It's already under consideration. And it's a question of how and what happens in terms of these needs as well. I mean, you have a country right next door to you with quite significant water resources, Canada. So I'm sure that this will be on the table. Yes. Right. I'm only too happy to. This is my third visit to Milwaukee. I saw it in winter, and it was a different city. So I'm now beside the water, so I'm very happy. And my trip last time was to visit Marquette University and visit the Water Council. Now, there are various entities in this country that deal with water, but the unique thing about the Water Council is it's a window between government, universities or research institutions and private sector. And what kind of knocked me off my feet was the number of companies that they have in the Water Council. They have this wonderful building. I think it's got, it has maybe something outside or a pump. It's working directly with the major companies that are engaged, private sector companies that are engaged with water supply at the moment. You have Veolia. You're all aware of Veolia. Veolia has actually done some magnificent things in developing countries for water and sanitation. I worked with them in Philippines on the typhoon response when they sent in a whole pile of the teams of their highly qualified engineers to work on waste management, wastewater management and waste disposal management. And highly trained sanitation engineers that were sent in. Badger meters that are also working there. Metering of water. We've talked about tariffs. If you don't meter water, you can't charge. So there's all sorts of relationships that the Water Council are developing between countries. They have researchers from China, researchers from Japan, other countries that are working directly there, linked to their own universities back in countries. China has significant problems on its water. And there's no question that the Council can have a really leading role in liaising directly with countries, with private sector in countries, with governments in countries, and advising those countries in ways forward and what they can be doing to address some of their problems. So the Council is quite wonderful, and I hope that you all get the opportunity to learn more and know about the Council.
An MCM production.